All right, we are getting all of our tech together here, coming online. Thank you guys for watching. We'll wait just a few more seconds for anyone who wants to join our live stream today. We are going to be talking a little bit about hearing in masks and hearing through masks. So I've got with me Dr. Stacy Pickleman. She is our lead audiologist here at Advanced Ear, Nose, and Throat in the Advanced Hearing Centers. Dr. Pickleman did her training at Central Michigan University in the 2000s, did a fellowship or residency internship program, I guess you'd say, at the California Ear Institute. Did a little bit of work in private practice, and then we found her about 5 or 6 years ago, and she joined our team here and now is responsible for basically doing the majority of our hearing aids and a number of hearing diagnostics that we do in our office. Dr. Pickleman, hello.
Hi, how are you?
I know we've all gotten very frustrated with trying to talk through masks, and I can see it on the in the expressions in my patients' eyes. My folks who have a little bit of hearing loss, we know, is forthcoming, and that little bit of hearing loss really is like exaggerated, magnified, 2 times, 3 times, 5 times while we're wearing these masks, because it's changing not only the pitch of our voice and the volume of our voice and the sort of the clarity of our voice, but it's also eliminating any of the visual cues that we normally use to try to interpret speech when we can't hear that well. Did you have I'm assuming that you had a fair amount of training regarding some of this, hearing loss and how we use visual cues. And this has really kind of pushed us to the limit a little bit this year with all of the COVID distancing we're doing. Is that right, Stacy?
Yes, that's completely accurate. Even with normal hearing, I'm having a hard time hearing people with just minimal hearing loss. And a lot of patients are now coming in, I can't hear with these masks. I'm not understanding the clerk at the grocery store, for instance. So we've actually been doing a lot more diagnostics and first-time diagnoses of even minimal hearing loss. The good news is there's a lot of devices out there now that we've been trained on how to even the hearing devices better when you are faced with the mask dilemma. One of the manufacturers that we use actually came up with a mask mode option, which has been huge.
Now you mentioned that to me. I heard you say that the other day, and I sort of did a double take. Whoa, what are you talking about? And that's kind of what sort of triggered me to want to do this little 5-10 minute chat session today real quick with our patients. So mask mode on hearing aids, what is that? How do I get it? What does it do? And what do we do next?
So it's on the newer models of the devices. It's through a company called Signia, and it's actually a free app that you get on your smartphone, and it's literally a tap on the mask, and what it does is it brings out the speech and lessens kind of more of the background noise. It really does enhance the speech. Even one-on-one conversations, I had patients demoing it in the office, and they preferred it kind of all the time on mask mode because it really did bring out much cleaner, crisper speech for patients.
So it's kind of a quintessential example maybe of some of the technology that's going in to the, the programming and the microprocessors and all that packed tech that's really inside that hearing aid. It's not just a little megaphone in there. It's actually a lot of computer technology trying to use a little bit of AI and smarts and programming brain power to remove some of the fuzzy mask distortion that we're getting and replace it, removing that, and then basically letting natural human voice filter through as good as possible.
Correct. And also with wearing the mask, we have we have less room, I guess I should say, less real estate behind our ears, especially if you wear glasses, a mask, and hearing devices. So a lot of the things that we're working with the manufacturers on is how really to, even if you don't have a hearing aid that has mask mode, how do we simulate that in their new in the technology that they do have, so we can go in and manually program to have that better clarity, especially during these COVID times with wearing masks.
Right. So, and thank you for sharing that with us. I think it's an awesome little addition. We've been talking now for about 5 minutes, and Seth from marketing says, if you talk for more than 5 minutes, people stop listening. So we are going to plan a little bit longer, in-depth sort of talk back and forth here the next week or two online. But right now, how do patients get a hold of you? How do they find us? Dr. Pickleman, let us know.
can either email me at spickleman@advancedentpc.com, or they can give Advanced ENT or Advanced Hearing Centers a phone call that they can get on our websites. And it's pretty easy to get a hold of us.
So we do sort of prefer most new hearing patients meet a doctor, meet a physician, but they don't necessarily have to. If it's pretty routine audiological findings, Dr. Pickleman can sort of figure that out. But if there's anything questionable, she might pop you over to one of the doctor's offices to have a look or clear the ear canal or make sure no other diagnostics need to be done. But again, that's advancedentpc.com. Seth from marketing says we have to stop. Omar from IT says you're not supposed to share your email address online, Stacy, but I'm glad you did. We have a direct way for our patients to give you a call and contact us. Again, 404-943-0900 is the phone number, or advancedentpc.com. Thank you very much. Have a good weekend.
Thanks, you too.
All right.